Medicare annual wellness visit is a great opportunity to allow providers and practitioners to really know our patients a whole lot better. My name is Dr. Cheng Ron here at the Texas Center for Lifestyle Medicine. I'm going to go over exactly what the components are for a Medicare annual wellness visit. So, as a Medicare beneficiary, you have access to these annual wellness visits, and they're really divided into two components. One is, which takes the majority of the time, is more questionnaire based, and then the other portion of it is more having to do with a physical exam by the practitioner that you're actually seeing. And as of recently, we can actually do this separate times if it's more convenient. And so let's talk about what the components actually are. And so, other than getting information such as your height and weight and other vitals, part of it is getting a health risk assessment, and that's very individualized. And a lot of times, this includes this questionnaire about different injuries and falls, behavior risk, and urgent healthcare needs. And so, one of the biggest eye openers for me is that I get to see how people live in terms of functional ability. So, sometimes that could mean hearing impairments or risk of fallings and previous falls. And we're able to really get a lot of information, seeing how people are on their daily lives within the Medicare annual wellness visit functionality ability assessment. It also gives an opportunity to learn more about our patients, including the medical and family history, and also who are our patients living with. Are there resources that may be limited? And there may be resources that people have access to, but they just don't know. And also, are they using things like canes or walkers or any sort of other medical equipment that may need to be either serviced or replaced or something like that? And so, and that includes certain things that are medical equipment and even non medical equipment, like devices that just make lives easier. And so, another aspect that we check for is prescriptions. Are you taking prescriptions, including supplements and vitamins? We want to make sure that all that is nicely arranged. And do our patients have an organization to taking these prescriptions or supplements and vitamins? And do they are they taking it correctly? Um, there's another aspect of the wellness exam that we do as we talk to our patients. Is really assessing how our patients are speaking. Are they showing signs of stuttering or early dementia or memory loss? So those are some things that we want to look for if we're finding these things, or if the patient's already diagnosed with some sort of memory impairment. Is it getting worse? And that's one of my favorite things to really do for our patients, because a lot of memory issues can actually be preventable, because most memory issues are actually not dementia. They're usually something else that looks like dementia. And so it's really important to get that assessed and not be afraid of memory loss. Another thing that we do during the annual wellness is screen for depression. So depression seems to be like a word that no one likes to use. But believe it or not, most people who are depressed, who with depression, don't think they have it. And not only that, they don't think there's any reason for them to feel that way. I just kind of want to validate everyone's feelings that if you feel depressed or down about something, that we can call it for what it is, and getting help earlier on is just so much better. And also, we want to be able to provide our patients with referrals to and health education, access to our health coaches here at Texas Center for Lifestyle Medicine, for preventative counseling, for group sessions, and to really join our community and be part of our community to promote overall health and wellness. And we also want to talk about habits. Is there any smoking or are doing any activities related to illicit drugs? And also, is there any malnutrition? All these things are conversations that I really want to have as overall risk factors for promoting the health and wellness as well. So that's really more the questionnaire portion of the annual wellness. The second portion of the annual wellness is a physical. And so that could mean checking your blood pressure and heart rate and everything like that. And then also going over the healthcare assessment that we just completed and updating everything, and also doing a part of the physical, maybe screening for cognitive tests that are actually tests that we can do to look at reaction time, short-term memory, recall, sequence of events. And it's actually fun for a lot of people because they can do it on the iPad or on the paper and pencil as well. And then also the last thing that we look for is there an opportunity to provide more education for our patients within this annual wellness physical? And what does that education really look like? Well, most people are kind of going through life not knowing or realizing that there's things that they can do about their health. So we really take this time to try to empower our patients with things that are very easy to do. I call them small yeses to do at home to really improve the quality of life. Not necessarily just working on something for a disease, but actually improving their quality of life, even if they're not diagnosed with any diseases. So that's one of my favorite things to really talk about. So my health coaches, my team here at Texas Center for Lifestyle Medicine, really truly passionate about the annual wellness and the preventative services, and hope to see you soon. Thank you.